Assalamu alaikum wa rahmatullah wa barakatuh. We'll continue in the second lecture with the introduction of pharmacology. And after we end with pharmacodynamic, we'll continue with pharmacokinetic. Pharmacokinetic defined as it is the reaction of the living tissues to the presence of the drug. When the drug enters the body, the living tissue will deal with it as a foreign material. So there will be a reaction from living tissues to the drug. These reactions include four processes, which are absorption, distribution, metabolism, and excretion. Absorption and distribution determine the onset of the drug, which mean what we mean with onset of the drug. We mean the beginning of the action of the drug. So when absorption and distribution increase, the onset of the drug will increase also, and vice versa. While metabolism and excretion determine the duration of action. The duration of action, that means how many time or how time that the drug act in the body. So when metabolism and excretion increased, the duration of action of the drug will decrease. Now we will beginning with the first process. It is absorption. By the way, when we said that when we arranged these processes as absorption, distribution, metabolism, excretion, does not mean that the absorption beginning, after end of the absorption, the distribution beginning, etc. No. Really, all these processes occur in the same time after the first amount of the drug reach the bloodstream. So, we're beginning with absorption. It is defined as transformation of the drug from the site of administration to the blood circle. Of course, this process, as you know, need or require passing of the drug through all cell membrane or through cell membrane. You know, the drug may be administered through or by mouth, so it's need to cross cell membrane in the intestine, or by injection in the muscle, so it is need to pass through cell membrane in the muscles, or subcut or IP, etc. Any type of administration require that the drug cross the cell membrane to reach a bloodstream or a blood circle. So the concentration of the drug depends on the rate of passage through membrane. When the concentration, when the drug or a big amount of a drug pass through membrane to blood circle, that means the concentration of the drug in the blood will increase. And we must keep an information in our mind that cell membrane is lipoid in nature. As you studied before, in the structure of cell membrane, it consists layers. Mainly it is lipoid in nature, and this is an important thing we will need after that. There are three major methods for transport in general in any material, not only the drugs. The first one is passage through pores, which called filtration. You know there are pores in the cell membrane, so some materials could enter the cell through these pores. The molecules which pass through these pores must have molecular weight about 3000 Dalton and less. But unfortunately, all drugs have molecular weight more than 3000 Dalton. So the drugs can't pass through the pores and then cannot reach the blood circle by this way. The second type of transport, it's a specialized method. This type of transport take place by using carrier. Something carry the material from outside the cell to the inside the cell. So it divided into facilitated transport. It occur a low concentration ingredient. So the carrier only use in this type. This type of transport, which called facilitated transport, it's occurred according concentration ingredients, which mean the material transport from the high concentration to the low concentration. And in this type, the carrier only used in this type. There is no need to energy, just carrier transport the material from high concentration area or side to the low concentration side. The second one is active transport. It's occur against concentration ingredients, which mean the material transported from low concentration side to the high concentration side, and in this type the carrier used and need energy. The third type is pinocytosis. It is occur by engulfing the molecule by formation of vacuoles, and as exactly what amoeba did to get what its need. It is engulfing and then molecules and then transport the material inside the cell. The third type of transport through cell membrane, it is simple diffusion. It is simple diffusion, which is the main way by which the drug passing through cell membrane. This is the important and the main way by which the drugs pass through cell membrane. In this type, the material dissolve in the cell membrane and pass to the cell obeying concentration gradients. So in this type also the material or the drugs pass or transport from high concentration side to the low concentration side, but by dissolving in the cell membrane. So we said before that is the cell membrane is of lipoid nature. Mainly the constituents of the cell membrane are lipids. So when a material required to dissolve in the cell membrane, it must be lipid soluble. The materials in general divided into two types according to their solubility in water or oil. The materials in general either water soluble, which is polar or ionized, or lipid soluble, which is non-polar or non-ionized. The non-ionized part of the drug or non-polar parts of the drug or lipid-soluble parts of the drug, this part, it is the part which cross the membrane, while the water-soluble part, it cannot pass through the cell membrane. So if we need if we need the drug to transport through cell membrane, it must be non-polar or lipid soluble or non-ionized. But mainly the drugs are mostly weak electrolytes. That means the drug contains the two parts. If the drug is a weak base or a weak acid, it is that there is an ionized part and non-ionized part, which is lipid soluble, and the degree of ionization or non-ionization differed from material to another. Here in this equation we see acetyl salicylic acid, which is aspirin. It is a weak acid, and there are two parts in this acid: non-ionized parts and ionized parts. Of course, the non-ionized parts is the part which cross or pass through cell membrane. But what is the things that make the non-ionized transform to ionized? The acetyl salicylic acid, which is aspirin, it is non-ionized. It is in its nature, it is non-ionized acid. But when it is be in acidic media, it will ionize by freeing hydrogen and become ionized with plus hydrogen. So when this weak acid become in acidic media or in alkali media, it will transform from non-ionized to ionized by getting H plus hydrogen ion. While in weak acid we see aniline, it is when gets hydrogen ion will come ionized, and without hydrogen ion it will be non-ionized. H concentration, which means pH, in the body affect the two examples above in reversible way. How? If the aspirin, which is weak acid, become in high pH base, that means there are a many or a lot of hydrogen ion, so there is no need to lose hydrogen ion here and become ionized, so it will stay non-ionized, and this is the important part of the drug. While in aniline, when become in acidic media, it will there is a lot of hydrogen, it will get one of these ions and become unionized. So when the aniline become in acidic in basic media, when become in become in basic media, and there is a few amount of hydrogen ion, it will stay non-ionized. From the above, we get a Henderson-Hasselbalch equation. The Henderson-Hasselbalch equation, that's mean in acid, the acidic material will lose hydrogen and become ionized, while in base, the base material will get hydrogen and become ionized. So pKa, which mean ثابت التحلل, equal pH and logarithm concentration of non-ionized acid on the concentration of ionized acid, while in weak base pKa equal pH and logarithm concentration of ionized base on the concentration of non-ionized base. And you see here that in an acidic and base equation, the non-ionized and ionized become a reversible way, which means here the ionized acid, while here the ionized base, and here the non-ionized acid, and here the non-ionized base. So from this equation, when pH increase, the ionized acid, the ionized parts in the weak acid will decrease, and this is important to absorb the acidic drugs, while in weak base, where the pH increase, the non-ionized part will decrease, and this is the an important thing in the absorption of the drug. From the equation mentioned before, we get two conclusions. Acidic drug absorbed better in acidic media, but acidic drug with low pKa does not absorb in any pH. Why? And then the basic drug absorbed better in alkaline media, but basic drug with high pKa does not absorb in any pH. Also why? The answer of why in these two conclusions, it will be the quiz of you in the next week, and I will get your answer about this questions electronically on the classroom. As we said, that the absorption is the passage of the drug molecule from site of administration to the blood circulation. And there are 2 points must be considered, which are, first, rate of absorption. The rate of absorption in some sites is more fast than other sites. So we could arrange the sites of administration from the lowest rate to the highest rate. The lowest rate of absorption, we will see it in the oral. Then it is faster than oral is subcut. It is faster than subcut is IM. Faster than IM, it's IP. And of course, the faster one is IV. Really, there is no absorption in the IV route because the drug enter the blood circulation directly, so there is no absorption in the IV route. The second point is completeness. This is completeness. We will find it in oral route only. That mean absorption of whole drug or not. Why the completeness and important in oral route only, because all other routes, either IM, subcuts, or IP, all these route of administration, the drug completely absorbed, while in the in oral route, the drug may not completely absorb. Part of the drug will go with intestine to the large intestine and getting out of the body. In some cases, the drug completely absorbed. In other cases, the drug poorly absorbed. And in some cases, the drug partially absorbed. This depends on many factors mentioned below. So the completeness of the drug in the oral route differ. In some cases, the drug completely absorbed. In some cases, the drug partially absorbed. And in some cases, the drug is poorly absorbed. Why these differences in the absorption of the drug by oral route? We will see the factors affect the absorption. The drug which given by oral route may be absorbed in any part of GIT, but the most drug absorbed in two main parts of GIT. Two main parts of GIT in which the drug absorbed. Acidic drug absorbed mainly in stomach because of its acidic media. Alkaline drugs absorbed mainly in upper part of intestine because of its basic media. So the factor which affect the absorption of the drug via oral route, now we are talking about oral route only. First, lipid solubility. When the lipid solubility of the drug increase, or when the drugs have high lipid solubility, it means the drug will increase. This means that increasing the drug absorption, whatever the pH of the drug media. Then the first factor is lipid solubility of the drug. When the drug have lipid solubility characteristic, that means it will be absorbed more and completeness. The second thing is vehicle. Some vehicles يعني مادة مساعدة. And some vehicles increase the absorption of the drug and other decrease the absorption of the drug. This the third thing, rate of passage of ingesta. Fast passage of ingesta المادة الهضمية أو المواد المهضومة. The fast passage of ingesta through the intestine will decrease the absorption of the drug because the drug will pass fast through intestine, while like in case of diarrhea, while the slow passage of ingesta, that means the slow passage of drug through intestine, so the drug will be absorbed, or the amount of the absorbed will be more as in case of constipation. The fourth factor is the state of GIT, full or empty. Of course, the state of GIT affect absorption of the drug, but in general, most drug absorbed better in empty GIT, while some drugs absorbed well in full GIT. This depends on the nature of the drug. Then, now factor affecting the absorption of the drug in parenteral routes, which mean IM, subcut, IP, other routes than oral routes. In peripheral routes, the drug completely absorbed after parenteral route, but some drugs absorbed fast, and other drug absorbed slowly. The first factor is the blood flow in the area of injection. This is the main factor. Increase the blood flow in the area of injection lead to increase absorption of the drug. So the drug which increased by IM would absorb faster than the drug is increased in the subcut. Why? Because the blood flow through the muscle is higher than the blood flow subcut or subcutaneous layer. The second factor is the presence of other drugs. Mixing of some drugs decrease or increase the absorption of the drug after injection. Example: xylocaine, local anesthetic drug, مادة مخدرة موضعية, absorbed fastly, but prolonged action needed adrenaline mixed with xylocaine, and this lead to decreased absorption and increase the duration of action of xylocaine. Xylocaine is a local anesthetic used by dentists, أطباء الأسنان, to anesthetic the area of their work. But unfortunately, xylocaine is absorbed fast, very fast. So it will the anesthesia will be short. So it mixed with adrenaline. What's the action of adrenaline? It constricts the blood vessels in the area, so the blood flow will decrease, so the absorption of the drug will decrease. This make the xylocaine stay in the area of injection for a long time, so the anesthesia will be durate for long time. The third factor is vehicles. Some vehicles added to parenteral drug to decrease its absorption. Example: oily vehicle added to some antibiotics or hormones to make this drug absorbed slowly, leading to increase their duration of action. So some vehicles may be used to decrease the absorption from site of administration. Many hormones, mainly hormones, an oily material added to hormones to make their action for longer. Why? Because the oily material will decrease the absorption of these hormones, which mean it stay for a long time in the site of administration, and then the duration of action will be longer. Also, physical factors affect absorption of the drug in the parenteral routes, like increase of or decrease drug absorption after injection, like presence of tourniquet. التورنيكيت بالعربي هي اللفافة أو قطعة المطاط اللي تشد اللي تربط على اليد أثناء سحب الدم. مثلا وجود تورنيكيت في منطقة الانجكشن will decrease the absorption of the drug. Also, presence of edema. When an edema found in the area of injection will decrease also the absorption of a drug. On the other side, heating will increase the absorption of the drug. When the heating presence in the site of administration, it will increase the absorption of the drug. From these four factors, we see there are something participated with all of them. That means all factors above depending on the decrease of a blood flow and the increase or decrease of the blood flow inside of injection. Now we will begin with the second process of pharmacokinetic, which is distribution. Now we will continue with distribution. It's defined that it is the process by which the drug is carried from blood circulation out to the compartments, which mean organs of the body. You know there are major organs, or which called central compartments, and this compartments is highly vascularized organs, and there is a poorly vascularized organs, which mean peripheral compartments. The drug in the first distribution of the drug first go to the central compartments, which like liver, kidney, heart, brain, lung, etc. And then the drug distributed to the poorly vascularized organs like muscle, adipose tissue, bones, etc., which is peripheral compartments. Distribution of the drug is not equal. Generally, the drug distributed to the whole body water, either extra fluid or intracellular fluid, but in different percentage, which means 20% of the drug will distributed to the extracellular fluid, which include plasma, intestinal fluid, etc., while 80% of the drug distributed to the intracellular fluid, which is the main action. So the main action of the drug is through intracellular fluid. There are an equation to calculate the volume of distribution. Volume of distribution is the volume of the drug distributed in the body. And it's calculated by liter to each kilogram. The equation is volume of distribution equal dose by milligram or kilogram for body weight divided on the plasma concentration by milligram per liter. So when this milligram will deleted with this milligram, the volume of distribution will be calculated by liter per kilogram. Distribution of the drug is not necessary to correlate with the site of action. That's mean the distribution of the drug is not occur according to the site of action, which means if we administrated a drug to treat a disease in the muscle, does not mean the drug will be high concentration in the muscle. No, it will be high concentration in the liver and low concentration in the muscle, but it exerts its action in the muscle. Factors affecting distribution. Third, vascularity of organ. We see here in this curve, the curve will down fast in the first time. Why? Because the drug distributed in the central organs, which is highly vascularized drug. And then the curve will be slowly decreased because the drug distributed in peripheral organs. The second factor is lipid solubility. Polar drugs are of limited distribution. As we said before, the polar drugs or polar parts of the drug is poor lipid soluble, so its distribution will be limited, while non-polar parts of the drugs is highly lipid soluble, so it is highly distributed. The third factor is storage depots. المخازن التي يخزن فيها الدرug. The drug may be stored in some area in the body, which are first plasma protein, second cells, and third the adipose tissue. Plasma protein binding is the first storage depots of the drug. Many protein found in blood called plasma protein, and the drug may bind with these proteins molecules. Example, albumin, globulin, transferrin, etc. The drug in the will bind with the plasma protein here in this equation and formed a complex of drug and the plasma protein. The drug only cross the barrier, while plasma protein will stay in the bloodstream, and also the complex of the drug and the plasma protein will be cannot cross the barrier. In the kidney, the drug pass to the urine, while plasma protein cannot cross to the urine. But when the complex of a drug and the plasma protein here reach the kidney, the bond will reverse. This bond will reverse to the other side and the drug isolated from the plasma protein. Due to the differences in crossability, so some drug will be liberated, become alone, and leaving the plasma protein to the urine. Due to this process, the drug will not stay in the body. What is the importance of plasma protein? First, loss of pharmacological activity of the drug, and this is important because if the drug will have its pharmacological action, it will act for long time in the body, and this will be harm to the body. The second importance is limited of the drug to blood circulation and distribution, and this means that the drug will be not stay in the blood circle, so it limits distribution and excreted out of the body. Third, prolonged drug presence in the body, and this is important from the other side. If we want to drug stay for a long time in the body, so it must be high protein binding affinity. What are the factors interfere with degree of protein binding? A drug concentration correlates reversibly with protein binding, which means when there is decreased concentration of the drug, there will be increase in protein binding because there are many proteins free to bind with the low amount of the drug. The second factor, protein concentration, correlate irreversibly with protein binding, which means when there are highly concentration of a protein, it will mean that means there are highly protein binding. The second storage depot is the cell. Some drug, when enter the cell, will be bind with cell molecules. So the concentration of the drug will be inside this cell will be more thousands times to its concentration in the plasma, like quinacrine and polymyxine. Quinacrine is a drug used in treatment malaria, and polymyxine is an antibiotic. These drugs, when enter the cells, they will bind to the molecules, cell molecules, bind to the molecules found inside the cell. So it will be concentrated inside this cell thousands times than their concentration in the plasma. The third storage depots is fatty tissues. Some drugs have affinity to accumulate in the fatty tissues, and stay for a long time because the fatty tissues is poorly vascularized. Like insecticides, مبيدات الحشرات, like DDT, arsenic, etc. These compounds, these chemicals have affinity to bind and to stay and accumulate in the fatty tissues of the body and stay for long time, which lead to chronic toxicity with these chemicals. Now we will complete in the other lecturer with metabolism in the next lecturer. Thank you very much.